Great. Thank you so much for your patience, everyone. Welcome, everyone, to the first ever Climate Equity LA series for 2025. We're excited to see so many folks join us as we cover the topic of safe and clean air at home. We have a lot of information to go over, so we'll get started right away. And we know that as relevant as this topic is, we know a lot of you have a lot of questions. We will do our best to answer them as many of them as possible. So I really want to encourage you to enter your questions in the Q&A module. You could find the Q&A module at the bottom of your screen. It should say Q&A. We will also be sending an email with all of the presentation slides and resources mentioned throughout the presentation at the end of this presentation. We also have Spanish and American Sign Language interpreters available for this event. To access the language interpretation features, please click on the globe at the bottom of your screen and select either Spanish or American Sign Language. If listening in Spanish, please also remember to select the mute original audio to hear the Spanish audio only. Please feel free to also write your questions in the Q&A channel in your preferred language. We will note your questions down and try to respond to them later in the session as well. And before we begin, we now present to you our land blessing. We want to honor the land, air, and water through the Indigenous ancestors. We acknowledge the original Indigenous residents of this land. Los Angeles was founded on unceded land of the Tongva, Chumash, and Tatavia nations, lands without borders. By drawing inspiration from Indigenous wisdom and the city's diverse cultures and experiences, we seek to create an equitable decision-making process to achieving climate and heat resilient solutions for the present and future residents of Los Angeles, while paying proper respect to this land and its original stewards. We seek to build reciprocity while prioritizing Indigenous and frontline community resilience, and with all Angelinos today and tomorrow, to respect the land, water, nature, and air that we share to create a livable, resilient Los Angeles for all humans and our animal relatives in their homes. So, it is my pleasure to introduce one of our speakers today. She's Marta Segura, the Chief Heat Officer for the City of Los Angeles and the Director of Climate Emergency Mobilization Office. So Marta, please take it away.
Thank you, Christine, so much for that great facilitation of the introduction. And thanks to my entire team, Rebecca Garade, Amy Clark, and Gordon Haynes, our Deputy Heat Officer, who have all had a part in helping to develop the work here for today's webinar, and I just couldn't do this without them. And as Christine was mentioning, yes, I'm the Chief Heat Officer and the Director for the Climate Emergency Mobilization Office within the Board of Public Works for the City of Los Angeles. And I just want to put out there that I have a master's degree in public health from UCLA. So welcome all Bruins and welcome everybody. We're really excited to have you here. We had such a great response to this topic. I know there's been a lot of discussion about the wildfires, but one thing that keeps on coming up again and again is the indoor air. So what's kind of interesting is we had thought about this topic long before the wildfires happened, but we thought, hey, it's something that we need to stick to. There's a lot of other people covering the wildfires, and there's so much that we can do in order to protect our health indoors. So that's why we decided to stick with this topic. And we're really honored to also introduce you to Dr. Jill Johnston from USC. There she is. She's an associate professor and director for the Environmental Justice Research Lab and the Division of Environmental Health at USC. And she's focused quite a bit on air pollution and indoor air pollution, epidemiologic exposure assessments to address inequitable exposures to harmful contaminants. So thank you, Dr. Johnston, for joining us today. We're really excited to have you with us.
Thank you for the invitation to be here.
Great. Next slide, please, Rebecca. So very briefly, I want to go over the agenda. We will cover indoor air quality and why it matters, what the health impacts are of indoor air pollution, sources of indoor air pollutants, and how we reduce air pollution and allergens. And then we'll take questions from the audience. We'll leave plenty of time for questions from the audience. At least that's my goal. And then we'll talk about some of the resources we have. Next. And as the adult educator that I was trained as, I was taught you always start a workshop with goals. And these are very much connected to our agenda. So by the end of this discussion, I hope that each of you can connect indoor air health impacts to climate change, that you know what the primary health impacts are from indoor air pollution, and tips for keeping your air safe and clean at home. That you'll be able to identify the various sources of indoor air pollution, or many of the various sources of indoor air pollution, identify how to reduce indoor air pollution, because that's something that I hope that most of us can control. And then we would like you to, our call to action will be for you to commit to some of those specific actions and create a routine plan to reduce your indoor air pollution. Next. And I wanted to, before I pass it on to Dr. Johnston, I wanted to have a brief overview of how climate change and indoor air pollution are related. Basically, I think that most of us know that climate change is driven by the overuse of fossil fuels and gas, and that has led to extreme weather pattern changes, such as extreme heat, such as the wildfires that we're experiencing now, because the Santa Ana winds used to be in the summer exclusively, and now they've moved to the winter. And all of this is as a result of, or a large percentage of this is as a result of climate change. So we can connect the bigger picture of climate change to extreme weather, and extreme weather as impetus for the air pollution that we experience. And that's where I think I'm going to transition it over to Dr. Johnston, so she can talk about the overarching sort of impact of air pollution and as a source of indoor air pollution and how it impacts us every day. And we have this graphic to sort of help everybody visualize what she's about to share with us. Dr. Johnston.
Yes, thank you, Martha. So, why are we talking about indoor air quality? So it is a very important environment to consider when we think about our health. And that's one, because for most folks, we spend a lot of our time indoors. And we breathe about 10,000 times more air per day than we drink water. This is something we do involuntarily. So we're breathing air all the time, and we can't really replace the air that we breathe. The indoor environment is also important because not only do we have air pollutants that are outdoors that can enter our indoor homes, our schools, our offices, but also we can generate pollution inside. And so, as Martha mentioned, the use of fossil fuels for cooking, so like gas stoves, is a source of air pollution. The different cleaning products that we use can be a source of air pollution. And even some of the building materials or furniture in our home can also impact our indoor air quality. And so this is why it is sort of important to understand what all these different sources are, because they can come inside of our homes and then we can be breathing them every day.
Can we move to the next slide, please? So that we can have Dr. Johnson review some of the health impacts from indoor air pollution. I know that we've listed them here so the audience can sort of just absorb them as we're having this discussion. But let's start with respiratory risks, Dr. Johnston.
Sure. So many of the pollutants that we're talking about, especially this fine particulate matter, which we often refer to as PM 2.5, as well as nitric oxides, which is a result of combustion. So you get both from like the combustion of cars, but also from natural gas stoves, can increase the risk for both exacerbation of asthma, but also some breathing symptoms like wheezing or increased risk for COPD. And so some of this can increase your risk of both having asthma attacks, needing to go to the hospital, or just having a hard time breathing.
And it's harder to connect indoor air pollution with heart attacks or cardiovascular risks, but can you give us a a brief explanation of how that happens?
Sure. So many of these pollutants that we're talking about that we experience both inside and outside, we know can also increase our risk for heart disease. And so this can happen through different inflammation pathways in the body. And so that
Mhm.
can put more strain on your heart. It can potentially increase blood pressure. And with long-term exposures, then can lead to these increased risks for different cardiovascular or different kinds of heart diseases.
Great. So basically, these particulate matters or gases or VOCs that come from indoor air pollution put a lot of stress on your body, therefore creating an inflammation pathway that leads us to possibly heart disease or fast palpitating heart, which are all symptoms, right, that we need to watch out for, particularly on days that you know that air pollution is higher outdoors, since that's the main source of indoor air pollution. Now, we wanted to talk a little bit about, or maybe a lot about, vulnerable populations, starting with infants. Can you talk to us about why we need to highlight vulnerable populations when it comes to indoor air pollution?
Yeah, so we know during different life stages, you can be more susceptible to impacts of pollution. So,
Mhm.
pregnant people, and particularly the fetus, can be very vulnerable to impacts that happen to the pregnant person, sort of including impacts of air pollution that can impact birth weight or preterm birth. We also know that children breathe more air per weight of their body than adults do. They also tend to be running around a lot or doing a lot of physical activity, and that also can increase your breathing rate. And so they can breathe more pollution per weight of their body than adults. We
Mhm.
know also their lungs are growing, their bodies are growing, their brains are growing, and so they can be more susceptible to some of these bad impacts from air pollution. And then
Mm.
finally, we know some communities, especially when we think about LA, already contend with numerous air pollution hazards in their neighborhoods, like truck traffic or refineries or oil wells. And so that can also, compound the multiple sources of pollution in one neighborhood and increase one's susceptibility.
Great. And I think we're going to talk a little bit more about this later, but I guess I'll say it again that if there's terrible outdoor air pollution, it permeates to the indoor air. And that's one of the major sources of indoor air, particularly in these communities where there's already a lot of pollution and pre-existing health conditions. And the last point that we have here is cognitive decline, both for children and adults. I know that there's still more research that needs to be done, but can you tell us a little bit about why scientists are looking into cognitive decline and connecting it to air pollution?
Yeah, so over the last 10 years, there's been a lot more research looking at some of these fine particulates, so PM 2.5, and how that may impact the brain. And
Mhm.
so we think that some of these pathways that increase inflammation in the body can also impact our brain function. And so it's both been observed in adolescents, so in youth, seeing kind of lower learning in
Mm.
people with higher levels of air pollution exposure, but also it may accelerate some of the cognitive decline later in life, like when we're thinking about Alzheimer's or dementia. So some of
Ah,
this work is newer, but there is kind of building strong evidence that there's a link between air pollution and the brain.
thank you, Dr. Johnston. That's something that all of us really need to pay attention to, since we know that dementia and Alzheimer's is on the rise, particularly in vulnerable communities. And we want to make sure that all of us do everything that we can to protect our communities and our families from these different potential sources of those types of health effects. Next slide, please, Rebecca. Um, and I'll take a little bit of time here because want to talk about heat, but basically we know that during heat season, extreme heat exacerbates air pollution, particularly indoor air pollution, and poses an even greater risk to health. And I think that we've seen from research both at USC and UCLA that there's increased incidence of um, hospitalizations, ambulance calls, and mortality during heat season. but there's an interesting connection between heat and air pollution, where air pollution exposure increases due to the rising temperatures, and the rising temperatures stagnate that air, making it much more dangerous to your lungs and to your respiration. And so that's why we need to pay attention to these kinds of risks during heat season. And we also know that hotter, drier heat seasons create the kinds of conditions that we want to avoid fires either in the urban area or the wildlands, or the interface between wildlands and urban areas, because the closer our homes are to these wildlands, and the more wildland areas that are prone to wildfires, the more fires we will experience. And you've already heard this, but it has so many gas pollutants, carbon monoxide, and toxic products that we won't go into here, because you've already heard it probably at another webinar about the relationship between fires and toxic emissions from everything that we have in our homes, from phones to batteries to plastic products. The other one we haven't really talked about too much is allergens and pollens. Those also are very seasonal, and we need to pay attention to those because those also have an inflammation pathway. And if you have allergies, you know this. And some of us get these allergies later in life. So, like, for example, I was never really allergic until very recently, but now this is a source of respiratory symptoms for myself. And then the last thing I have here is mold, how extreme heat and humidity can exacerbate the growth of this fungus, which thrives on moisture and very warm temperatures. I don't know if you'd like to add anything to that, Dr. Johnston.
No, I think this is a really comprehensive list, and also kind of important to consider how factors like more heat days and hotter temperatures and more extreme weather, like even thinking about the rains we're having today, can also impact indoor air quality.
Thank you. And next slide, please. And this is something that many of us in this webinar have seen, but basically it's the heat vulnerability index. And what it shows us is that there is a strong correlation between pollution burden areas, housing burden areas, extreme heat, and also pre-existing health conditions. And so this map, unfortunately, continues to show us again and again that these areas that are in red or orange and even yellow are much more vulnerable to pollution, fireworks smoke, fire smoke, because they are already living in the kinds of conditions that none of us want to have for our neighborhoods. So one of the goals of the city, and indeed the Climate Emergency Mobilization Office, is to ensure that we prioritize and highlight the kinds of solutions and investments we need for all of Los Angeles, but particularly these vulnerable communities that have had some historic disinvestment in the past. So I think that this is a really helpful map. And there are many other maps that I didn't bring today, but I did just want to correlate this with the vulnerable communities that Dr. Johnson brought up just a little earlier. And I want to thank UCLA and the state of California and USC for any data that we might have used to create this map. Next. So we do have a poll for everybody. And that first question is, let me see. What indoor air health symptoms are you most affected by in your home? So we have about a minute to answer that question. So just think about when there's smoke, when there's heavy ozone during the summer, where there's both firecrackers and or if you just live in an area like Wilmington, right, or Pacoima, and there's frequently outdoor air pollution, but there's also conditions within your home because you live in an apartment where the landlord doesn't get to the repairs when they should. That might be another source of indoor air pollution, right? The mold that we were talking about earlier, the allergens that aren't being removed because you don't have HVAC, you don't have air conditioning, you may not even have an air purifier. Speaking of which, the city is already, Mayor Bass has already made air purifiers available at Family Source Centers and at Rec and Parks facilities. And we'll make that information available to you soon. And then in about 4 weeks, we'll be getting another batch of air purifiers to distribute. Next, great. Rebecca, did you want to share with us what the results were for the poll? Ah, okay. Nobody answered. That's okay. Maybe Dr. Johnson can give us some of the symptoms that are most prevalent in Los Angeles for the audience.
Yeah, I mean, we hear, respiratory symptoms as something that's frequently talked about, particularly if you have asthma. Oftentimes, trying to control your indoor environment can be a very important factor for controlling your asthma. And so, thinking about what products you clean with. I think odors is also something, and some of the, just adverse feelings that you get if you smell bad odors, something I hear people talk about. And another thing is just some kind of uncomfortability, especially when it can be very hot out. And so, sometimes you can feel, stressed out when it's really hot or have a hard time sleeping. So those are just
Yeah.
different factors that I've talked to people about.
Is it kind of similar to when during the summer when we have heat season, the brain loses oxygen from excessive heat? And some of that might be because of excessive indoor air pollution. So people have, mental health breakdowns. They also feel dizzy. So some of these are signs that you may be experiencing these climate hazard risks. And the important thing is to stay hydrated, and also to get yourself into an environment where the air is cleaner. So we often refer people to go to our public libraries when it's hot. But I also think that if you're experiencing indoor air pollution like we were with the fireworks or with the wildfires, you can also use our public facilities that have really advanced HVAC systems and air purification systems, so that your body gets the rest that it needs, but also gets hydrated. And also, you can get more resources at our libraries now for addressing some of these health issues too. All right, let's move on. Dr. Johnson, these are the previous one was your slide, so maybe we can go back briefly to the previous slide, Rebecca. Great. So now we're going to talk about sources of indoor air pollutants a little more. I don't know if there's something here that we already haven't covered that you'd like to highlight.
Yeah, I mean, a couple of the things we mentioned here is just mention this idea of VOCs. So that stands for volatile organic chemicals. It's a broad class of gases that's present in a lot of the materials that we can use in our houses or things we bring into the home. Also in like cleaning products or in, glue or construction products that we use. Sometimes these can smell. So that's kind of another one to be aware of. And then we didn't mention, but pests, dust mites, cockroaches can be another sources of really things that can trigger both allergies and asthma exacerbations. So another factor to be aware of.
Great, thank you. Maybe we can skip over the next slide because I think that's also sources of indoor air pollution. Yeah. And we talked about VOCs. We also talked, is there anything here that's different than what so cleaning activities, I know that we've transitioned from using, chemical cleaners to more like a white vinegar, non-toxic products, and those are much more available now. So I definitely encourage folks to, get the more non-toxic cleaners to clean their home. Anything else that you see here, Dr. Johnston, that you want to highlight?
Yeah, I think two things. One, there's a lot of cleaning products we can really make with simple ingredients, so they don't cost more, because sometimes these ones that are labeled as green are also more costly. So I'm
Mm,
happy to provide some resources and recipes for that. I think
great.
another important one to consider is, oftentimes burning incense or candles is a source of indoor air pollution.
Yeah.
Also, things that release odors. So, a lot of times, the odors that are released through these plug-in type materials are these VOC compounds that make the air smell good. And so,
Mhm.
considering alternative or other natural products could also reduce some of those exposures indoors.
Yeah, and it's just as an anecdote, the other day I was walking down a mall with my sister and she wanted to go inside Sephora and I started to walk in when I was overwhelmed by all of the odors that are, like expensive odors, aromas. And I was just like, oh, this is just too much. So even your perfumes and your colognes and your makeup can be a source of indoor air pollution. And I just wanted to mention the gas stoves a little bit more because there are a lot cheaper what we call induction stoves that are plug-in. So even if your landlord does not replace your gas stove for an induction stove, you can get the plate. And so then if you have family or you are asthmatic, you can cook without gas. And you have the option of cooking without gas because there are these plug-in induction stoves now. Great. Next. Okay. Well, this is just basically a summary of all the outdoor sources of indoor particulate matter, and some of which apply here, like vehicles, airplanes, factories, refineries, wildfires. And I'm sure there's more than this, but I just wanted to make sure that we highlighted that outdoor air impacts indoor air. Next. And we did dedicate one slide to wildfire smoke. So, Dr. Jill, do you want to talk about this for a second?
Yeah, so we know just like ambient air pollution, particularly in Los Angeles, wildfire smoke is also a complex mixture. Um, those initial few days, most of us experienced really high levels of particulate matter. And so that's all the fine dust that can be, what becomes ash or can rain down on your homes. But there's also a lot of other potential compounds to consider. So some are toxic metals. These are most
Mhm,
often attached to some of the fine dust, right? They kind of stick together. And then other kinds of gases. So that's what's listed here with these
mhm,
other hazardous air pollutants, carbon monoxide, it's also combustion products, and polyaromatic hydrocarbons. Again, these are things we see due to burning. And so the
mhm,
levels become much higher during wildfire events when they're burning. We know it's burning both wildland things, but also homes, cars, a lot of human products, which can contain different sources of chemicals.
mhm. And I want to thank all of the agencies that have been providing information on how to clean your indoor spaces after the wildfire, because it has been sort of something that LA hasn't experienced at this level before. I have friends who had to clean their homes as well, and they ended up calling, like the EPA, the Department of Public Health, the AQMD. And the thing about indoor air is that there really isn't a jurisdiction that's responsible for indoor air. Like the CARB says that they regulate cleaning materials, but there really isn't an agency, not even the city of LA, for example, that regulates indoor air, that has expertise for indoor air. So we did try to include materials at the end of this that might be helpful to all of you. But again, we're all learning through this really horrendous experience, and we're hoping to provide more information to you as as soon as we get it at CEMO and at the City of Los Angeles. I will say that everybody would be encouraged to change their pillows and to change their linen Some folks had a lot less exposure than others. So then that's where it gets nuanced and tricky, where I would actually call a restoration expert or maybe the Department of Public Health has more information at this time to assess whether or not you need to remediate your mattresses and so forth. So we'll share all of these resources and slides later, along with the recording and the links and the resources that will be available to all of you. Next. And this is basically just what Dr. Johnson was talking about earlier in terms of gas stoves and some of them actually leak. So they're even more toxic than when you're just cooking. They release nitrogen dioxide, methane, benzene. So if you have vulnerabilities like COPD or asthma or cancer, I think the recommendation is to keep those individuals away from the stove while you're cooking, as far away as possible, and then to ventilate if it's possible to ventilate. I know that some scenarios we can't ventilate, and I think I'm going to pass it over to Dr. Johnson to talk about that nuance in that scenario.
Yeah, I mean, so that's one of the complexities that we face here in Los Angeles is that oftentimes we recommend to improve indoor air quality, you want to open up your windows, right? You want to have more mixing of air so things like from your gas stove doesn't concentrate inside. The complexity can be if the outdoor air is just as contaminated as the indoor air, that's not a viable solution for many homes, right? And if you're, not able to open your windows or factors like that. And so that's then when we move into thinking about different recommendations that can use these air cleaners or these indoor air filters to try to reduce some of the indoor air pollution.
Exactly. And we're learning more about the different types of air purifiers, air filters, how to use them in combination with HVAC systems, but also if those solutions are not, available to you when you most need it, and it's during the hours of operation of our public facilities, we invite you to come to our public libraries and other public facilities to get some fresh air, right? Next. So this slide is about how we reduce overall indoor air pollution and allergens, because we want you all to have like an action plan and priorities and identify which of these methods or solutions will work best for you. I know that you can't do them all, or you may not even need them all. And I know it's important for us to understand there's like an economic burden of some of these solutions, but we wanted to make this list available to you so you do have an action plan in moving forward with how to reduce air pollution overall. Sorry. I'll just call out a couple of things here. Using green non-toxic materials, inspecting your home for molds and leaks, monitoring your indoor air quality. It is possible now to monitor your indoor air quality. And I'm a big fan of using the plug-in induction stoves, especially if you have asthma or COPD. So next. And this is from CARB, the California Air Resources Board. And it's just a great visual on how to address indoor air pollution. Maybe I could move on. There you go. And this is another one on how to reduce mold through moisture control. Dr. Johnson, would you like to comment on the moisture control element of the mold reduction?
Sure. So, usually we don't have high humidity levels in LA, which helps kind of reduce how fast mold grows. But we will see it where there's leaks, either from the pipes or, when it's raining outside, if there's water that settles under your house or settles nearby, that can be a place where mold grows. And so you can see it in terms of, the actual mold growing, or if you notice the wood sort of decaying or rotting, that can also be signs of leaks.
Right. And I know that in showers that don't have vents, right, and the doors and windows are closed, that can also lead to mold. So let's definitely watch out for that and ensure that we address that. So these are more things of what you can do. Limit your exercise during high air pollution days, and definitely even indoors if you do exercise indoors. So you'll get these resources, and I think most of this has been mentioned. So let's move on to the next slide. We are here for Q&A, and Christine, you've been
Yeah.
busy collecting our questions.
Yeah, well, thank you so much, Chief Segura and Dr. Johnston. We do have quite a few of questions that we received both prior to the webinar and throughout this webinar. Please understand, folks, we cannot get to all of the questions that were submitted during this session, but please feel free to email us at cemooffice@lacity.org for any questions or info. And again, we will be sending a recording and the presentation slides in an email after this presentation, so you can keep an eye out for that. Moving on to some of the questions that we received. First question, we have a question that says, which is the best air purifier for a 1,700 square foot home?
Great. Well, sometimes, the air purifiers have their capacity. They could be for 300 square feet, for 1,500 square feet. But depending upon the layout of your home, you might need 2 or 3 air purifiers just to ensure that each room has a proper air purification. I won't tell you a specific brand, but I will say that it should have a HEPA filter, and it shouldn't be an ionic or ozone producing air purifier. So just make sure that it doesn't have ionic properties, or because those produce low levels of ozone, which can be detrimental and irritate your lungs. So Dr. Johnston, any tips on air purifiers?
I think that's great. The CARB, so the California Air Resources Board, has like a list of kind of vetted or like approved air filter
That's
systems,
right.
that won't generate ozone or produce some of these other harmful impacts. So yeah, we
Yeah,
can try to include that on our list of resources to share.
Yeah,
great.
we'll make sure to do that when we send out that email. The next question from Tiffany Rivera, she asks, what type of filters are needed in a central air system to be efficient in clearing the air on recirculate?
Do you want me to start with that? So
Yes,
with
please.
that, filters have a rating called the MERV rating. I can't remember the acronym, but we recommend to have a rating of 13 or higher. And this tries to decrease the amount of these dust particles, these tiny things that can impact your lungs from the air. And so you can find them at sort of commercially available stores, and looking for a rating of the 13 to 16 is oftentimes what you can find, and that won't adversely impact the ability of most systems to keep the air flowing and recirculating.
Mhm. And I'll only add that when you're changing filters for your air purifiers or for your vacuum, even if they're HEPA, you should probably put a P100 on and gloves on, so that when you're cleaning them out, you're not getting exposed to the dust that's been collected. Great. Next question.
Yes. So we have a question about HVAC systems. Do filters need to be replaced, or does the entire HVAC system have to be flushed out?
In most cases, it's just important to replace the actual filters. So generally, you want to replace them about every 3 months. But for example, when we've had kind of these high air pollution events or wildfire smokes, if you're able to replace them sooner, that would be sort of good practice to try to kind of, reduce and decrease the amount of pollution getting into your home.
Mm. And we'll put them into a black bag or something before disposing of them, and wear your respirator and your gloves.
Next question from is the City of Los Angeles or LADWP providing free to its residents devices that can detect indoor air quality?
No, we aren't, but you should be looking out for our air purifier distributions. Like I said earlier, some of the rec and park facilities are distributing them. Some of the family source centers are distributing them. And very soon, like in 3 weeks, we will be giving more of those to nonprofit organizations throughout the city and to the departments as well. So we'll be notifying the public of where you can have access to those.
And if I recently learned of another resource through the LA Public Libraries.
Okay.
They have kind of a community science program, and in those libraries, they will loan out these sensors for PM 2.5. And so those would work if you look outdoors or indoors, but as another very exciting resource that's available for people to borrow for a few weeks, and you can monitor your indoor air quality.
That's awesome. That's something I didn't even know. Thank you, Dr. Judson.
Um, we have another question regarding monitoring air quality. What devices can you recommend for monitoring the air quality inside of homes? And are there different devices you would recommend for monitoring outside at our public elementary school campuses?
So, it's always good to look at either the EPA or the regional air quality monitoring district to get some ambient air quality measures. For PM 2.5, oftentimes this is, more of a community or neighborhood level exposure. So those are high quality monitors, but we know they're not everywhere. So other devices that we use, although there's a lot of them, include purple air monitors, air beam sensors, and then I think LAUSD schools is also using one called clarity sensors at many of their schools. They all use a very similar type of device to look at PM 2.5. And there's a comprehensive list on the South Coast Air Quality Monitoring District's website of different sort of low-cost sensors that they've tested and they think perform well. But the chemicals that we can monitor well with these sensors include the PM 2.5 and ozone. So most of them won't give you information about like other toxic gases. So that's just important to keep in mind.
Thank you. Super helpful.
I think this is a question that a lot of folks here might have, and it's what can individual citizens do to protect their homes, to protect their, themselves?
Well, I think this whole experience with the wildfires and really every 4th of July when people get overexposed to smoke reminds us that we don't have a local jurisdiction that really addresses indoor air quality. So it is important for people to take this into their own hands, but also advocate, right, for resources to monitor, to clean, to understand what kinds of materials they should and shouldn't be using for cleaning products. And I would say I'll say this again at the end, create an action plan of steps that are doable and achievable for your home. And then, reach out to us or reach out to Dr. Johnston's team and we can point you in the right direction. Because yes, AQMD and CARB monitor and regulate air pollution as a whole, but nobody's really a specialist in indoor air pollution in terms of the regulatory agencies. So advocate, advocate, advocate.
Dr. Johnston, do you have anything to add to that, or we can move on?
I think we can move on. Yeah.
We have another question about the cooking. I understand that cooking, whether on gas or electric stove, negatively affects the lungs. Can this be addressed more, please?
Sure. So most of the research studies or health studies have focused on gas stoves. And because we know that they release this nitrogen dioxide, have looked at impacts on children, but other vulnerable populations in terms of their respiratory health or asthma symptoms. I don't know as much that's been out there just on electric stoves, There is pollution that can be generated, for example, like if you're, if you burn something, like we all experience like smoke that comes while you're cooking, but the electric stoves won't have that constant source of pollution that we oftentimes see with gas stoves. And so actions you can take, whether you have a gas or electric stove, is just trying to ventilate, and ideally being able to pull the air from the stove outdoors through like a hood. And so, or just being aware that when you're cooking, you can be generating additional sources of indoor air pollution. So if there's someone in your house more vulnerable, have them in a different room during that time can be a health protective step.
So for our next question, what happens to all of the indoor air pollutants, whether it's cleaned out air filters, bags of debris cleaned up from the fires, toxic cleaning products, etc., once we try to remove things from our homes? Do they go into the nearest landfill or are they washed out to sea, etc.?
Well, if they're filters and you're putting them into a trash bag, they go into a landfill, right? So, and same thing goes with your vacuum and your respirators.
I know the EPA is working in the fire zones right now to identify more hazardous materials at this first level of cleanup. And so those materials are being kind of assessed, and they're going to be, I mean, eventually likely go to a landfill, but the type of landfill will depend on the potential like toxic materials that are present.
Mhm.
So for our next question, somebody would like to address the third-hand smoking and the effects it has on people, pets, and people with disabilities.
Yeah. That is an excellent question. So, for folks if they're unaware, third-hand smoke tends to be if you're in a home where someone else who used to live there was smoking. So instead of being like next to someone that has smoking, you're now in a space where someone used to smoke in. And
Mm.
those kinds of smells and chemicals can absorb into things like walls or other materials. And I have not studied that, but there's other kind of health researchers that have looked at basically like these long-term effects from exposure to cigarette smoking, even if you're not next to the person who's smoking. And we see some, similar adverse impacts as with secondhand smoke, which is very similar to what we talked about with air pollution, right? Impacting the heart and the lungs. And so, um, so I think, yeah, as mentioned, particularly if you have young children, elderly, other vulnerable populations, um, thinking about ventilating your home could be a way to reduce some of those impacts. And I'm happy to look for more resources from others that are experts in the field to share.
Great. And I'm sure that happens a lot with hotels too, right? They claim not to have smoke there, but then you walk in and it's an overwhelming smell of smoke. Great. Next question. Yeah.
So the next question, do soft porous items like clothes, cushions, rugs, mattresses, couches, etc., need to be washed more often than once? And is there a specific method required?
Is this specific recommendations if they're impacted by kind of wildfire smoke? I think there's some resources we can share on best practices and some of the recommended items to use, especially for cleaning mattresses. But I think generally clothes or other cloth material, just kind of thorough washing, hot water. I don't know if you're recommending other actions, Martha, on linens.
No, I think what my friends ended up doing is just calling a restoration expert to assess the density of pollution in the mattress versus the other linen and their clothes, right? So she was confused. She's like, I don't know what to do. And that's what she ended up doing. But I know I'm saying this knowing that not everybody is able to call a restoration expert. This is really just with regards to the wildfire. Now, if you're just, in like, let's say in Wilmington, and there's a lot of outdoor air pollution that's coming in frequently, I would say yes, just wash as frequently as possible, because your washer has a filtration system that removes a lot of the particulate matter. But I
So
don't have but what I'll commit to doing is looking into that, because again, these are areas that are new to most of us, and we're just trying to make sure that we get the right information out there.
thank you, Marta. We only have time for about one more question, so this will be our last question. Please, again, a reminder that any other questions that you have and they're not being answered at this time, we will be sending it out by email, and you are, welcome and encouraged to send any questions to our office in an email. So last question, how long will LA's air quality be negatively affected by fires? The person still keeps their windows closed when they're usually open for air circulation in their small apartment.
Yeah. So I know there's been kind of a lot of concern around air quality kind of after the fires and ongoing. And I know a lot of people like checking the AQI every day. And, so in general, the air quality has gone back to LA normal. But LA normal is not great. We have a lot of sort of poor air quality days, and some neighborhoods experience this more than others. So that's when, it's in the yellow or the orange range if you're familiar with the AQI. Um, and so, but when we have rains, that actually helps improve air quality. It kind of flushes some of the particulate matter out of the air. So usually after a rain, it tends to be very good air quality days. But continuing to look at this and just kind of build that awareness around a lot of the sources of air pollution in LA and the need to really reduce and improve air quality so we can feel safe and breathe clean air.
Thank you. Was that our last question?
That's our last question.
Okay. So the next part is really this call to action to reduce indoor air pollutants. And I just wanted to encourage everybody to create their own action plan to reduce air pollutants and make it a routine. It's something that if, for example, you don't have the checklist from an agency right now on what to do, many of the things that we recommended are doable, and you can create your own priority checklist based on the symptoms that you experience, the pollutants that you have. And so I'd be really excited to hear later on from some of you that you've taken some steps towards creating a routine to reducing your indoor air pollution. And we're really, this is kind of a area that hasn't been explored enough, that hasn't been regulated enough. And it's a lot like extreme heat, right? The extreme heat standards just don't exist yet. The state of California is exploring them, the county is exploring them, and we're all just, advocating for those types of changes to ensure that everybody experiences a thriving, healthy community and has equal access to resources and has a long, happy, thriving life. And that's really what our goal is here. Everybody here on this panel wants us to all have equal access to these resources, equal access to clean air, equal access to clean water, and we're all working on this together. So let me know later on through our email whether you took this call to action seriously and were able to commit to a routine to clean your indoor air. And if you need any additional support or resources, we're here to help. And I just want to thank Dr. Jill Johnson again for being so amazing and giving us her time today. And again, my staff for helping coordinate this. And we'll send you everything as Christine promised, and even more that we might have collected during the conversation.
Yes. Thank you for joining, everyone.
So thank you, everyone. And thanks to the Board of Public Works and the City of Los Angeles and to all the staff.